afternoon, everybody. My name is Ron Verba. Today I'll be giving a speech over rheumatoid arthritis. I will discuss what rheumatoid arthritis, or RA as everybody calls it, is, what are the symptoms of RA, and what are the available treatments for RA. According to the Center for Disease and Control, the National Musculoskeletal and Skin Diseases Arthritis Foundation, rheumatoid arthritis affects 1.3 million Americans, roughly between the ages of 30 and 50 years old. But I want to make it clear that it actually can start at any age virtually. So that's just between 30 and 50, but any age. Most people seem to think that it only happens with old people, 50s, 60s, when it gets a little bad, but it actually starts much, much younger than that. Much younger. Depends on the person. Out of the 1.3 million people, 70% are women. Don't know why, it's just how it is. What rheumatoid arthritis is, it's a chronic disease that causes pain, stiffness, swelling, and loss of function in the joints. It's a chronic, like I said, chronic and an autoimmune disease, which means that what actually causes the pain is your own immune system attacking healthy joint cells. So it's a terrible disease. No one really knows the exact cause of RA. However, there could be a combination of factors based on what certain rheumatologists suggest. Those are the doctors that specialize in RA, rheumatologists. There could be a genetics as a cause. No one knows the exact cause, but genetics could be a possible cause. Environment, maybe an infectious disease from an outside source causes it. And lastly, they might think that female hormones combined with stress affects female hormones that could trigger it. Possible. Symptoms vary among people, but here are the basic symptoms. Causes tender, warm, swollen joints, morning stiffness that may last for hours, fatigue, fever, and weight loss. And like I said, it varies between person to person. Usually, the younger you are, the pain will most normally start at your hands and your feet. And then as you get older, if left untreated, it could affect your elbows, your legs, your back, and get much, much worse. At this time, I would like to introduce my visual aid. This person is among us, Ashley. Come on up. She actually has rheumatoid arthritis in its early stages. I will demonstrate the early symptoms of it. She's 25 years old. So she's not 30 to 50, like I said, virtually any age. So she's 5 years younger. Actually, she was diagnosed when she was 20, so 10 years younger than what they were saying. So you notice her hands are inflamed a little bit.
Oh no.
Her feet.
No symptoms.
Much different than a normal person's hand like mine is. They like to call it the days where it gets more inflamed, they call it flares. When they have a flare, that means it gets worse and then it comes back and then it happens again. That's a flare. That's a term they use. But yes, that's what the signs look like. Thank you. Appreciate it. Treatments. There are numerous treatments out there, such as anti-inflammatory drugs. They reduce the pain and inflammation, but they don't slow the progression or stop it. They are disease-modifying, anti-rheumatic disease-modifying anti-rheumatic drugs that are a little bit better, that can slow or stop the progression of RA by suppressing the immune system. And I'll talk about what the side effect of that is. And they're also, the newest form of treatment is biologics. Those are the newest and most effective. They are genetically engineered proteins that inhibit certain parts of the immune system that attack your healthy joints. That can stop the progression or altogether RA, or make it go into remission. But the side effects to the last treatment I said, and this one is by suppressing the immune system leaves you more open to infection than other people because your immune system is weakened. So, in conclusion, I just spoke to you about rheumatoid arthritis, what it is, what the treatments are for it, and I demonstrated what firsthand was the symptoms of it. Like I said, it affects any age. That was my main point of this speech, not just between 30 and 50 or the 60, 70, but 20s, teens. It could affect anybody.